we do have a question coming in from Deborah. What is new in treating microvascular disease, especially in diabetics? It's severely impacted, she says, by the blood sugars, and they don't always present in the same way as PAD. But even some, such as herself, that don't have diabetes and do have microvascular disease for whatever reason, she's wondering, how do you treat those patients that don't have general blocked arteries, but they have this microvascular disease that is debilitating?
Well, microvascular disease exists, is related to diabetes. It's for sure less frequent compared to what we have been believing in the past, because if you inject contrast from the aorta or from the groin or from the knee, you cannot evaluate most of the cases, specifically the small arteries in the foot. So microvascular disease is something that exists and we cannot treat. We cannot treat at all. But with the microvascular, I'm understanding vessels smaller than 1 millimeter. It means that I can open tibial arteries. I can open foot arteries. We have 4, 5 main vessels in the foot: 2 dorsal, 2 plantar, and the arch. All of these arteries can be treated and can be opened in most of the cases. As well, I can treat even the metatarsal arteries, so the arteries that go straight for every toe. I have multiple cases in which I arrive there with the 1.5 or 2 millimeter balloon. I dilate the arteries for the toe. So after this, what we have, the microvessels that can be not treated. Collaterals of collaterals, vessels that perfuse the skin or perfuse the tissues. Those arteries are the microvessels, and it cannot be treated, and it represents the microvascular disease. For the other arteries, even the small arteries, as described today, SAD, small artery disease, it means the foot arteries, the metatarsal arteries, those arteries can be treated. Yeah.
And what about, let's say, just to at least handle some of the symptoms, what do you think about like a nitro patch or something like that to try and help the spasming that occurs sometimes in microvascular disease?
Yeah, I don't believe in the microvascular disease, isolated microvascular disease. Diabetic patients with the CLI percent with the microvascular macro and micro vascular disease. And in most of those cases, when we open the big arteries, so even the small arteries, but not the micro, we realize that there is no so microvascular disease. And we realize that there are many connections between the microvasculature of the tissues. So at the end, if you provide a direct flow for the forefoot, for a toe, in most of the cases, you have a good chance to have a good perfusion and to improve the perfusion.
So in a
for sure, a combination of vascular procedure plus pharmacological support is the best option today.
So in a patient such as Deborah that presents with her dorsalis pedis being closed off, but no other sign of PAD anywhere, no other artery blockages anywhere else, but in the DP, you would have opened the DP.
Yeah, it's very strange to have a patient with only DP occluded.
Right.
Probably if she has plantar arteries patent and as well as all the tibial arteries patent, she could have an anatomical variation with an absence of a DP. It's present in 12% of the population. So I would like to see an angiogram of the foot in lateral view as well as in anteroposterior view to see if there is an anatomical variation or not. And for sure, if she's not in front of an anatomical variation, I think there is a big chance to open the DP, yeah, if needed, because finally symptoms, clinical indications should, how can I say, should support our procedure.
Yes. And Julie is asking if the duplex ultrasound shows that She has calcium in her leg arteries. Why would the doctor put her on 10 milligrams of atorvastatin? I can never say that. It's
Torvastatin.
yes, thank you. Calcium daily. Wouldn't the calcium she's asking in the statin add to her current calcifications, making things worse? I hear this type of question all the time.
Well, atorvastatin is cholesterol control, pharmacological control for cholesterol, for triglyceride. So all of these drugs have an effect, a protective effect for the cardiovascular system. So that's the reason why it's used for any vascular or cardiovascular disease. It's not specifically for calcium or no calcium. There are no drugs that can prevent calcifications or can remove calcifications from the arterial wall. So atorvastatin, statins are used as protective cardiovascular drugs.